Well, let's zero in then on Narayana Healthcare or Narayana Hridayalaya to talk a little bit about their numbers, because it's been a solid quarter on account of which the stock is spurting. PAT surging phenomenally to 85 crores. That's nearly 400%. You've got the overall EBITDA as well growing, and margins have expanded. Connecting then with Viren Shetty, he's the ED and Group COO at Narayana Health. Thanks so much for taking time out. Good to have you on board. To begin with, let's just talk about the strong quarter gone by, because there has been a gradual recovery after the kind of washout that we witnessed in the last fiscal. Just walk us through the factors that have aided this growth, and what do you believe has largely attributed to strong operational numbers as well as high profits?
Well, there's only one factor, and that is no COVID. In the absence of a second wave of COVID, our numbers would look even better in Q1 of FY22, but that unfortunately did not happen. So Q4 was our strongest quarter ever. We recorded a 9% year-on-year increase on just the Q4 numbers, but the FY21 obviously had that impact because of the preceding performance in the previous quarters. But yes, April month, we have seen a 7% decline in the revenue figures, and May, we're yet to collate the numbers, but May was a pretty bad month for us. But fortunately, COVID is, I wouldn't say at its peak anymore. It's quite declined across all our centers, especially in Delhi and Bombay. And in Bangalore, it is looking like it is stabilizing. So I would say June looks to be a little positive month, and hopefully a recovery from the Q2 onwards.
Okay. What about the overseas operations at Cayman Islands? Can you just give us a sense as to how things there have shaped up?
Sure. Cayman was quite unaffected by COVID because they took a very strong stand of locking down the entire country early, and they vaccinated about 70% of the population. So Cayman has been fine, barring that one incident in Q1 where we had to shut down the hospital for a contamination procedure. But there's been very strong domestic business. We have started opening up a lot more retail business across the island, and we've been able to compensate for the lack in international travel with an enhanced outpatient and other clinical activities. So Cayman has continued to deliver very strong performance for us. It ended FY21 with $68.6 million, which is a decent increase over the previous year.
Okay, great. You've also seen, a sharp rise in margins as well going forward. What are some of the factors that continue to aid that, and what's your outlook, and guidance now moving forward?
I wouldn't say a sharp rise in margins. I would say at least a return to normal margins. The thing about COVID, what it does is it does compress your margins in two ways. One is because COVID treatment itself is mostly price capped by the central government. The other is that you're not doing as many procedures. So you're bearing the burden of having a full service hospital with all the specialists there, but with them not having much work to do. And so hopefully as things normalize, we will be able to return to normal set of margins. If we had to do an overperformance over and above that, I don't see anything in the near term that would enable that. But the long-term factors that would aid that would, of course, be improving operational efficiency, a lot of the work we're doing on our digital transformation to reduce our costs, as well as, fingers crossed, if the prices do get revised by the government, that would lead to a margin increase. But otherwise, it would just be a return to normal.
Okay, fair enough. Now with the with the kind of expansion that you're looking at in Cayman, additional super specialty hospital as well, what's the kind of outlay? I think it's 100 million over the next 24 months. How is this going to impact operations, given the kind of outlay you're looking at, returns on that? What's the kind of progress on that front, and anything you'd like to update us on?
Sure. We are nearly done with all the planning and permissions. The thing about building in first world countries is that there's a lot more regulation that we have to comply with than we're used to in a third world nation. But that's more or less through, and we should be very confident about starting construction in this current quarter. It's done in two phases. One phase would include the oncology block, which will be ready in 12 months. The second phase would include the overall super specialty center. So that takes another 10 months after that. And so it would start impacting us only in the next year. But in the meantime, we are starting chemotherapy operations in all our retail clinics in the island. So some of that revenue that would come from oncology would flow to us, but that would only be medical oncology, not radiation oncology. As for the return, we took this project up after a great deal of deliberation and comparing all possible alternatives, which is if we were to do something in India, we do something in other Caribbean islands versus in Cayman. And we found this to, at least for right now, the most attractive return profile. And that's why we invested a significant amount of money on it.
Give us a sense as to what the outlook is on your total, on where you see your overall margins headed. I know you said that they're likely to normalize, but does that mean that you will manage to hold on to the current double-digit levels? And what about your overall expansion plans?
Yeah, it's very difficult to say because none of us anticipated such a strong second wave. And we don't know if there is going to be a third wave, and if so, when it's going to come. Barring all of that, I would say a return to normal double-digit margins is quite possible in a relatively quick time frame. What we do see, and we had seen in March, is that there's a huge bounce back. All the people that had been postponing their procedures will very quickly come back and get it done. So all it takes is removal of lockdowns, resumption of flights and train services, and just a return to normal activity does bring things to normal very soon. But anything over and above that would require, I would say, not COVID to be gone, but it to remain at a very slow ember. And I think it's very good that the vaccination drive has ramped up. And so that will give people a lot more comfort to get out there and get the other treatments that they need. The expansion plans going forward, nothing as of now. There is a lot of capacity expansion that we're taking up in our hospitals in Calcutta. There are a lot of oncology projects we'll be taking up in Ahmedabad, Jaipur, and a few equipment that we'll be renovating, but nothing major. This has all been disclosed and part of the normal course of what we were doing, but all those projects have been put on hold during COVID because it was impossible to get construction material and manpower to the hospitals. That will resume. And so basically it is a delayed expansion that we'll be taking up in this next year, but nothing over and above that.
Has there been, Mr. Shetty, a conscious lowering of your costs or cost controls that have been taken in order to also aid the overall financial performance? And is that likely to continue?
There were some emergency measures that we took last year. This was mainly around salary cuts, but those are not sustainable. You cannot keep that going for a long time. The long-term cost control measures are the ones we've been doing from almost day one. These are continuous improvement projects in improving supply chain efficiency, improving the manpower turnover. There are a lot of interesting projects we're doing with digitization and automation, which should help improve the throughput of a lot of the work that we do at the back office level, at front office, discharge, insurance desk, and so on. But those will be, adding maybe a few percentage points over the next 5 to 6 years as we add up. The truth is the huge amounts of costs that we do continue to bear are salaries, which cannot change and will only go up, and the cost of materials, which will only go up over and above inflation costs. So since we have no control over those two factors, I would say that most of these are just eating at the margins.
Okay. Thanks so much for sharing with us your outlook. We'll let you go on that note. That's the view coming in on Narayana Health. The stock holding out comfortably in the green as we speak, about 457.